മോളെ
നിങ്ങളുടെ വിഷമം എനിക്ക് മനസ്സിലാക്കാൻ പറ്റും. പക്ഷെ ഒന്ന് ഓർത്ത് നോക്കി, മറ്റൊരമ്മയ്ക്ക് അവനെ വിളിച്ചാവാൻ പറ്റുമെങ്കിൽ അതൊരു വലിയ കാര്യമല്ലേ?
ഞാൻ സമ്മതിക്കില്ല ഡോക്ടറെ. നമ്മുടെ വിശ്വാസങ്ങളും ആചാരങ്ങളും മറന്നിട്ട് ഒന്നും വേണ്ട മോളെ.
Today, July 1st, Doctors Day. So on this day, actually we all have so many programs. IMA has programs. Even all the branches of IMA are conducting a lot of programs with regard to Doctors Day, in spite of the COVID-related protocols are in force, and IMA has declared no face-to-face physical meetings. And see, everywhere a lot of activities are being managed. In the Foxy, right from today morning, there are a lot of activities, and the theme for Foxy's Doctors Day are the organ donation promotions. So, encouraging the people to do more of organ donation pledges and activity-related activities. So today, the Perindalmanna ONG Society is very happy to have the stalwarts in this field, representing Foxy as well as representing the National Organ Donation under the banner of IMA. So we have our respectable leader, Dr. Kamini Devi. She is Foxy Vice President 2020. Will be inaugurating this today's CME on organ donation. And also she will be releasing our society newsletter, that is e-journal, Metamorphosis. It is Metamorphosis. It is Metamorphosis. Okay, and also our members who have actively involved all the friendly activities like vegetable gardening and organic farming, organic cooking, and the pollution control and food management activities. I have involved in a lot of activities in the past 3-4 months, in spite of being held up at home with regard to the COVID and less number of patients at hospitals and all the stress around due to various reasons. So many have contributed in a wonderful way, and that e-magazine is named as Pranayam. Pranayam means love. Love with nature. So the wonderful collection of the photographs and the small write-ups, whatever amateur way members, and we can do it. We have done it completely, and all these things are government-friendly newsletter and e-magazine. So it will be broadcasted to all the members as soon as it is released by our Foxy Vice President, Dr. And regarding this, we had a wonderful talk by Dr. S. Vasudevan, and Sir is the professor at the Department of Urology at Government Medical College Hospital, and also active donation committee of IMA Kerala State, and also the coordinator of National IMA's organ donation movement. And there is the right person to tell you regarding this organ donation activities, and what's the benefit and how it has to be done, the blood test to be done, everything. So our target is, so from today, starting this awareness campaign, and on 13th of August, that is organ donation day, we will make a massive pledge by our society members. With these few words, I request Dr. Wahab to welcome the guest. Over to you.
Hello, welcome Dr. Ramani Devi Madam and Professor Vasudevan Madam into this program. And we are happy that July 1st and on the Doctor's Day, we got our Honorable Vice President of FOXI for this program, to inaugurate this program. And I welcome Dr. Vasudevan to start the talk
No.
on.
First we'll have the inauguration and a small.
Yeah, sorry. First to actually my net connection is not good, so please carry on, Dr. Kunjumaideen.
Madam, I cordially invite you to inaugurate this today's CME program, this webinar program on organ donation awareness, as well as to release two publications from our society, and also to show the video which you have got ready for organ donation campaign. Over to Madam, please share your screen.
Just initially I will talk. First, let me wish all the members of Perindalmanna a happy Doctor's Day. And I am really overwhelmed to see the response, what your society had shown. It was on the previous yoga day. You had arranged such a beautiful program. I went to the magazine, that is, and the e-magazine and your regular magazine to see. It was very nice. It was very informative. It definitely shows the talents of all the members of your society. So let me congratulate your society for such a fantastic work, Dr. Kunjumaideen and Dr. Wahab. Now I will try to share my screen.
Very nice to see, and very nicely scripted and taken in your hospital. And we have lots of appreciations coming in. And Madam, can you proceed with the next assignment that is released? Yeah, I can see.
Yes.
Congratulations for this wonderful. See, I can just roll through that, and you get so many topics. President Secretary's message, COVID-19 and pregnancy, and the second trimester uterine case report, and increased NT, what next, and so many other things. Sarclage versus thing, and you have nicely shown some of the photographs of your society activities and the reports. Congratulations. And again, there is, in the last is not the least, is your virtual reality conference, what you are going to have in 8th and 9th of August. Congratulations, Dr. Kunjumaideen, Wahab, and your team. Shall I go to the next one?
Yeah.
Yes. We can see.
So this is very nice to see the World Environmental Day celebration pictures. I have received more than 2,000 pictures, videos, drawings during World Environmental Day celebration. We have compressed it, made it into an e-book, loaded in the website, so your members can enjoy that pictures. I am very happy to see such an active member of the garden, and you people are really of Kerala. It will be motivating for the and I see so many other members of you having kitchen garden and cars and so many other things. And I think I've seen some of the recipes by the doctors of Perindalmanna or children of Perindalmanna. And congratulations for such an beautiful e-journal, e-book. And I'm very happy to release this 2 books during this program. Congratulations. Finally, with the Usha's picture, that's more encouraging. Thank you. to share the experience of one mother who was an organ donor.
Hello, I am Malati. I am here to speak about my experience as an organ donor. Although I have read and heard about it, I never did anything about. A year back, my son had a kidney failure, and I had the shock of my life, and I was helpless and wanted to save my son's life. I shared the news with Dr. Ramani Devi since we are neighbors. She consoled me, talked me through, and encouraged me to donate my kidneys to my son. She also showed me people who have donated organ where the donor and the patient are leading normal life. So I realized by donating my organ, not only I could lead a normal life, but also be saving my son's life. So I went ahead and donated my kidney today. Today both of us are fine. Now I have realized the importance of organ donation. I request all of you to be fearless and save a life. I also request everyone to donate your body parts after death, since there are thousands of patients waiting for an organ to survive.
On to the next session, the most awaited lecture of the day by none other than our Professor S. Vasudevan.
Vasudevan sir is ready, I think.
Head of the Department of Urology at Government Medical College Trivandrum. And because many people have joined later after the initial introduction. So, sir is the chairman of Organ Donation Committee of Kerala State IMA, and also the coordinator of the Organ Donation Program of IMA National Body. So, sir has vast experience in this field, and sir will be elaborating on various aspects of this wonderful initiative. And over to you, sir. We are eagerly waiting to hear you.
All, thank you, Dr. Kunjamoideen and Dr. Nawaz, I thought, the secretary of the SING. And I'm really very happy that the Perindalmanna Society, Obstetrics Gynec Society, has taken up this topic for SING. And very thanks to Dr. Jayakishan for having connected me with your esteemed society. It was during Jayakishan's tenure as the president that we conducted such a massive campaign in IMA state chapter to have a organ donation campaign. And during our state meeting, which was held at in nearby the airport, the Cochin airport, we had got a considerable number of our members to give consent for organ donation, voluntary consent for organ donation. They have submitted their consent papers. So that is and Jayakishan was also instrumental in doing in taking up the court case which IMA had when there was several questions raised about the validity of brain death determination, etc. So he is actually he has contributed a lot to the organ donation movement in Kerala. Now coming to the subject in which we have decided today. Thanks, madam, for putting it in the right perspective with an excellent video as well as the personal what they call audio video clipping of a donor. So these are the people who carry forward this movement. First of all, the relevance of this, why we need to talk about organ donation. We know that India is a big country and we have got people with serious diseases across the country. So a rough estimate which the nephrologists tell us is we have about 1.5 lakh of people who are at least 1.5 lakh people who have gone into end-stage renal disease or ESRD and who are awaiting a renal transplantation. But unfortunately, the infrastructure across the country is not enough. So maybe only about 10,000 patients get transplantation in time. It is due to a variety of reasons, like uh, unavailability of a good donor. Maybe they don't have as much access to the health care in all states uniformly. Maybe in the bigger cities they have access, but in smaller cities as well as in the villages, they don't have much access. Maybe it's a question of finance. Maybe it's a question of bringing everything together. So the net result is that a lot of them die without getting a transplant in time. If you consider liver transplantation, in renal transplantation, the advantage is that we have a procedure called dialysis, which helps keep them in living. Their whatever toxicity is there in blood, they are able to remove through dialysis and keep the patient living for days and months. But in the case of other organ failures, that service is not there. So a patient in liver disease, once they proceed to irreversible liver damage, there is actually very little that can be done other than arranging for an emergency liver transplantation. So that is what Madam said. I'm very happy to note that there is a liver transplant in Madam's family, a transplant surgeon in Madam's family. So we need such professionals to take up this initiative. So as things go, we understand that there is a lot of gap between the demand and supply. So because of this, we know that there has to be some initiatives to bring up the rate of organ donation. So this the initiative which have sprung up across the country through such professional bodies like IMA, professional bodies like Urology Society, professional bodies like Cardiovascular Society, and also with the help of several NGOs. The prominent among the NGOs would be Mohan Foundation, which has been headquartered in Chennai, which has got offices in many cities across India. They have been in the forefront in arranging the training of transplant coordinators. We heard in this video that the doctor herself talking to the patient's relatives. But in many corporate hospitals as well as busy public hospitals, the treating physicians may not get time to talk to these people, especially in the critical care ICU. They can sow a seed in the mind of the patient relative that this patient is not going to come back and they have a severe problem. So once that sort of attention is achieved, the rest of the message is carried forward by transplant coordinators. So they are trained through a structural program which is conducted by Mohan Foundation, a course of around 6 weeks to 8 weeks. After that, they are ready to face patients. So once these people are able to talk to the patient's relative, inform them of the progress of the patient, and then slowly tell the message that this patient is not going to come back. And then they slowly, as they gain the confidence of the patient's family, they will tell that they are going to, they have an opportunity to donate the organs of this person so as to ensure that this person is going to be immortal. And then starts the consent or process for the deceased donor donation. So having said this background, we know that any person who has got an organ failure has to have organ donation, transplantation done within a certain time frame so that irreversible changes don't occur beyond a certain limit. So having said that, we have to ensure that our patients receive organs in time. We said about the big supply gap between the demand and the supply. So how can that gap be sort of bridged? So there are several ways it can be bridged. The first of which is we know that a person has got 2 kidneys, a person has got, so 1 kidney can be donated if this person is fit medically to donate. So that once that selection is done, he is ready for a live donation. We know that blood groups have to match. There are also donations where blood groups incompatible with blood group can also undergo the procedure. So that is regarding the kidney donation. kidney transplantation. For a liver failure patient, suppose there is somebody in the family who can donate, a part of the liver can be taken and it can be transplanted so that the patient can keep living. So similarly, so we know that there is only a certain limit to what is possible from a live donation. Whereas the second option would be from a patient who is going to be brain dead. So that is, we heard the video about that patient who is approaching brain death. And what is the concept of brain death? We know that there is a time when the function of the brain will stop. So when do we actually declare brain dead? When actually a patient dead, most often it is cardiovascular death. So there is a small interval between cardiac death and brain death, which is the time which is effectively used for this deceased donor donation. How do we ensure that things happen in this time frame? So actually, that is what the video which Madam showed had highlighted, that actually we have to act fast. So there is a small window. It may be a day for certain patients, maybe for certain other patients it may be a week, because these patients are all under cardiovascular support, so, or respiratory support. So it is up to us to see that this process is over within that time. That is why the preparation of the patient's relatives has to start once we know that the patient is not doing well, and will culminate with when the consent is given. After that, once the brain death determination is done, we'll have to go ahead and do things again faster. So how is brain death declared? There are actually at least 4 steps which are used for this brain death determination. One, we know whenever we have all determined death in the ward during our residency days. That is when we have shine a torch into the patient's eyes, we see that the pupil is fixed and dilated. Where this test is used for determining whether the brain activity is getting less. Second is when side-to-side movement is given, we understand that there is a Dolce movement which is lost. The third would be the response to pain. A patient who is in coma also will not show a response to deep response to pain, but they can be brought back once the cause for coma is done. So coma is reversible, whereas brain death is not reversible. And who determines these things? There is a committee which has been denoted by the government. It consists of the superintendent of the hospital, the treating physician, a designated neurosurgeon or neurophysician from the government committee, as well as the another person who would be from the hospital itself. So these 4 persons meet and they have to determine the brain death. And this has to be done 2 times within a span, with a separation of 6 hours. So if both these examinations confirm brain death, the patient has to be officially declared as brain death. And once the first set of brain death determination is happening, there is always an opportunity to tell the patient relative that this patient is conforming to the criteria of brain death and we have to take consent for organ donation. So if at that moment of time the relatives consent, we'll have to start the process of organ donation. Now I'll come to how this is done a little later. What is the third mode of organ donation? That is through a process called a paired donation, paired kidney donation, or it is called chain donation. So what happens here? Here sometimes we have a suboptimal donor. That is, the tissue characteristic of a particular patient and the donor and the recipient may not be the best available. So there is an opportunity to go and take kidneys from another person from whom it might be more suitable. So what do they do? If we have 3 pairs of patients, that is donor and recipient, maybe here the donor of the first pair will donate to the second recipient. whereas the donor participate in this, and we have a process whereby all people get more appropriate kidneys for this thing. Same with liver also. So this will expand the pool of patients who are available for donation. So coming to how this process is determined, who is a good live donor? A good live donor is always a patient who is free of many of the medical diseases, and the age criteria they say is between they have to be between 18 and 59. And in the extended criteria, they found out that this criteria was not and they should be free of many of the medical diseases. They should not have any active infection, bacterial or virologic, especially the CNS diseases. They should be free of the blood diseases which are spread through blood, and they should be of good mentation so that they're able to give valid consent. And once these criteria are all deserved, they undergo tests to determine whether they can donate live. And after that, they undergo this. For in the case of the kidney, they undergo a angiogram. They undergo this the variety of this test, including X-ray, ECG, and they are assessed by various specialties to know whether they are fit to donate. Once all this has been cleared, the adequate cross-matching is done so that an appropriate live donation can be carried out. And most importantly, they are assessed by a committee, institutional committee, where if it is a close relative, suppose the donor and the relative are close relatives, there is the definition what forms a close relative. Can be either a father or mother, they can be siblings, they can be children or grandchildren of these things. And within this close circle, it can be done by the institutional committee. Whereas any expanded nature of relative or non-relative will have to go through higher committees, which may be a zonal committee which has been constituted by the government. And those people who are donating to people outside the state will have to go through a state level committee. So these committees will consist of people also from the psychiatry and from the forensic medicine to determine whether, and also a government representative to note whether there is any instance of money being so whether it is an altruistic donation or a paid donation. So it is always the policy to discourage paid donation, and altruistic donations have to be the process. Again, there is a lot of debate on whether this paid donations really happen or not, because we understand that a lot of unrelated donors, which are obtained through this advertisement, are often done in a very what do you call secret manner. But there is very little that at present where they can. There are a lot of ways where they escape these regulations, and many a time it is to be expected that these things are happening. And there is a lot of controversy, especially our state secretary has been pulled by many people in social media for stating many of these things. So it is in many international level meetings, this has been a lot of subject of lot of criticism. We have had many people who are visiting us from other countries, and many of them have commented about this aspect. So it is something which is happening, but it's not really, should not be really allowed. Now, when we come to this deceased donor again, actually, how does this deceased donor, how does the allocation of this happen? Because we know, we earlier talked about how the process of deceased donor determination, brain death determination happen, and whether how does this encourage the more kidneys being available. So any potential recipients, that is those who all undergo organ failure, it is the treating doctor who has to register them in our the state government organized KNOS, that is Kerala Network for Organ Sharing. That is a government initiative, and they have got a website which is open to everyone. where the treating doctor has got the opportunity to register them for teaching. And here again, there will be, according to the date of registration, they will be waitlisted. And there are certain times when certain patients, especially those who are critical liver or critical heart failure patients, may be listed for emergency surgery. Otherwise, most often they undergo according to the wait list. Some patients, at a point of time, some patients may be too sick to undergo this procedure. So they will be temporarily taken out from the list. And once they are back to health and they will be able to withstand the surgery, they will be brought back into the list. So that is how this list works. It is open and everybody can see what is their position in that, what is their order of priority. So it is based on this list that allocation occurs. Now, how does this allocation occur? Often, when there is a brain dead patient available, or when there is a potential, as Madam said, the most common situation where this sort of brain death determination and organ donation occurs is through when road traffic accidents occur. And it is a pity that many of these patients are very young patients who undergo tragic accidents and cannot be saved despite the best care being available. Another set of patients who come into this situation are patients who are of middle age and may have a cerebrovascular accident. Other situations are also possible, but these are the most common two situations. And once such a patient has been identified, we told about their journey in the critical care ICU. So once they're, despite the best care, when they don't progress well, it is often the situation where such a thing can be thought of. And as I told earlier, transplant coordinators are the people who actually come to work at this moment of time. They will identify this potential brain death donor, and they will talk with the families through their daily or hourly contact. They will establish a rapport with the families of this patient and slowly encourage them to come into this idea. So as it goes, they will take up this, accept this, and once that is accepted, this process is set into motion. So then KNOS will now allot according to this to the patients, and often in our state, if the harvesting is taking place in a government institution, the allocation will be to the government institution, and one may go to the private sector. If it is similarly, if it's in the private sector, this one of kidney may come to the thing, and liver, it will be shared, will be given allocated to the institutions often within the same zone. We have 3 zones: south zone, central zone, and north zone, and often it will be shared within the same zone. And if there is no recipient, potential recipient in the same zone, it will be offered to the adjacent zone. If there is nobody in the state to receive that, it will be shared to the other state. So that is the usual policy. We started deceased donation in our state in 2012, when the first case was done in Government Medical College Trivandrum. And later, now every year we had a very good number, increasing with numbers. And till about 2 years, 3 years back, then suddenly there appeared some opposition to that. And there were some court cases which caused the government to issue a new set of regulations. And because of the criticism which occurred in the social media and in various other media, there was a lot of people were discouraged a lot from donating, and suddenly numbers dropped. What happened as a result? A lot of patients began to have difficulty in getting organs, and slowly the program became faced a downturn. We were helped a lot by the Tamil Nadu society in modeling our system. So what happened is in 2012, after it started, in about 2 to 3 years, we became one of the second best state in the country in performing these procedures, just behind Tamil Nadu. But slowly we slipped down, and whereas several other states like Rajasthan, Delhi, Maharashtra have also now started picking up. So this year we have been seeing more interest in donating after the government has issued a new set of guidelines how to determine brain death. And we hope that this momentum will carry forward. With this at this juncture, I would also like to say that there has been a lot of interest in uterine transplant, which have been happening in some centers across the country. But I am not very familiar with the modalities of that, but I guess there must have been a lot of such presentations in your gynec societies. So, so it is all the more interesting that this interest in this topic has come from the society. So I think with this small thing, I would like to stop for now, and I would expect now what one more point. Actually, we were discussing. I was told earlier by your president, Dr. Kunjumoideen, that you are starting a campaign, and probably on the National Transplant Day of August 13th, you are planning to give a substantial number of consent letters. So the process, why is this consent letter important? Actually, it is an expression of support. We know that it is just because a person has given a letter, organ harvesting is not going to happen. In our laws in India are that we have to agree. It is a question of opting in. That is what in our country. So there are several countries like Spain, many European countries where it is opt out. So the healthcare is such developed that all the health activities are done by the state. And once a patient is very sick, the body belongs to state. So there, organ donation is a matter of already decided. So any patient who is fit for organ donation will automatically go to that pool. And suppose a person has got, as we said earlier, some disease whereby there is some severe infection or some blood like meningitis, or whether there is diseases of blood transmission, or they may not be taken for testing. So those patients opt out. But in India, it is a question of opting in. So even if we give our consent letter, at that moment where there is a determination of brain death, the family has to consent for organs to be harvested. So basically, as doctors, when we give this consent letter, we are offering our support for this program, as well as showing a model to the public that this is a safe procedure and it can be done with it brings a lot of thought about the seriousness of our intention. So that is, I think, I would like to stop with this and would happy to answer any of the questions that are put in. Thank you. Thank you once again for the opportunity, and very happy to have been talking to this August audience. Thank you.
Thank you so much, sir, for that wonderful elaboration on various aspects, especially the consent-related aspects of organ donation. Naturally, everybody, especially we need not tell about the non-medical people, even the medical people, medical members of our medical fraternity are very much reluctant to go ahead with all these organ donation formalities. And it is high time that we should break our silence and we should get into the fold. Then only we will be able to, then only there is a point in doing awareness campaign for the general public. We ourselves should come forward and set the role models. So that's why we thought, even myself and Dr. Wahab, we both got ready with the pledges, but we thought we will declare it along with many other members of our society on 13th of August. See, we have 114 members, 114 members. At least our target is to have at least 25 pledges to happen on the day of 13th of August. So main hindrance, I'll tell you, I feel the main hindrance, and so many feedbacks are also coming. See, it is the issue of discussing the issue with the family members. How it has to be done, like sir has told, your class has enlightened on that point very much. and the doctors, especially for example the members of our society, should find time to discuss with the family members the advantages and disadvantages. And see, Madam's video is clearly shown. That is a great message. It's a really convincing video. Sir, please.
Yes. Actually, I would like to say the contribution of our past National IMA President, Dr. K.K. Agarwal. It was during his tenure that I got this opportunity to work in this national scenario also. I told him about this thing. Actually, he is a very person who is very much aware that this is a need of the hour. So he gave me a small slogan as soon as he talked to me. He said in simple Hindi, Puchna mat bhulo. That is, in these situations, it is a responsibility of the medical profession. Puchna mat bhulo. That is, never forget to ask. In a critical care or situation, there is always a responsibility of the treating physician to ask for organ donation. Just sow the seed, and that will many of the people are actually noble-hearted. They will slowly think in their mind, and they will decide. Actually, I will also tell you about my one story which I know. There was a year when I started working in the Kerala state level. At that time, our state president was Dr. Srijatan Kumar. So there we honored, Dr. Srijit honored with our this award, the highest award of IMA at the Nilambur conference to our Dr. Neelakanta Sharma's wife, Lata Sharma. Actually, in that situation, he was a 43-year-old lawyer who was practicing in Trivandrum Bar. Suddenly, he fell ill with a CVA, and he was admitted to Sri Chitra Medical Center. So, when the transplant coordinator told about that, she immediately said yes. She had two young boys, and anybody who is in a very sad situation will never think of saying yes. But she said yes because Neelakanta Sharma had always mentioned to his wife that he would like to donate his eyes in the time of his death. So that made her realize that he was for organ donation. So she didn't ask even her close relative. He immediately said yes. So that is the importance of previous awareness and such people. And that was the case where for the first time, when Ummanchandi sir was the chief minister, and for the first time, a heart was flown from Trivandrum to Kochi for a heart transplantation. So I think whole of Kerala watched that live in TV. So that was an important landmark in the organ donation history of Kerala. So that is the importance of previous awareness. That is where this sort of submission of form help. It creates a lot of awareness and attention. And that is the importance of celebrities coming. For our state, actually Mohanlal is the official ambassador of KNOS. So all of these people have been putting a lot of their time and interest into this. So, and sustaining this program.
And one doubt is those who have already agreed for organ donation and happen to die during this COVID time, what is the protocol for taking the organs? Because even the cremation during COVID time, the protocol is very stringent that we have to do a lot of activities before cremating. So is there any protocol for retrieving the organs in this particular scenario?
Yes, actually, I am very happy to tell you that till now, actually during the first months of this COVID problem, that is, we were in March and as well as April, Kerala had very little cases. So we were in an area where we didn't have much of the ill effects of COVID. And it was during this time, that is second half of April as well as first week of May, in Trivandrum we had 6 cases of deceased donor donation. So it happened all as a cluster. And since neither the donor nor the recipient had tested positive for COVID, we were actually able to go forward with the donation. Here, because this brain death determination is in the ICU, this harvesting also takes place in the hospital where the patient is in. So actually, all these COVID protocols do not actually create a hindrance. Once the patient undergoes a rapid test for thing, all these patients underwent the rapid test. Their results were available within 45 minutes, and we approached the government what to do, and the task force for COVID met and gave us permission to go ahead. So once these official things were taken care of, things fell into place and we were able to. And we should remember that at that moment of time, actually across India, no institutions were doing this, because many of the institutions which we were doing, for example, Ahmedabad IKDC or Delhi Max, they were all in areas where there was high incidence of cases. So they all refrained from doing these cases. And when we looked at the statistics across the world, we found out that many countries had stopped doing this, especially Spain, USA, all had to stop doing transplantation activity. So we had a unique situation where we had done many cases, and that was actually appreciated by even the Chief Minister, that we went ahead and did it. So regarding that question, I feel when we are in a situation where there is clear testing available and it is proved negative, we have gone ahead with the case.
Okay, so you mean rapid testing is enough, but it do not have that much sensitivity. But once after you start harvesting the organs, and this rapid testing, because it is not that sensitive, and will it make some error, because it may transfer the infection from the dead person to the recipient?
Yes, actually we were guided by our infectious disease specialist, Dr. Aravind. He's also a team in our institution, and because that moment we didn't have much of cases, and actually now it is much more, and we are probably on the verge of community spread. So at that situation, actually we were more confident of taking up those cases. I wouldn't say the same now, because there is a lot of, and there is suspicion that there are some cases we really don't know the source of the infection. So at that time, fortunately, we didn't have any doubt in our mind. Once the government gave permission, we went ahead.
Yeah. Okay. So that's a good answer. And any other doubts by the audience attendees can post the messages that we can ask as doubts. And can you share the consent forms and all? I think the Foxy has already done. And is there any updated informations in the consent forms or anything in the recent past few weeks or months?
Yes, I will. Mail it to you. There are several ways we can submit our consent form. In IMA, we had a system where we were collecting, but you can even submit online to KNOS. If you see the KNOS site, there is a opportunity to submit this donor forms, this sort of consent forms online for them. So we can take the forms from them, from their site, and actually we can submit it online. And it is always good that we download a card, a donor card from this site, and keep it with us, so that the importance of that is that having submitted this, there should be a record that we have submitted, so that even our close relatives are aware that we have done this. Once that is there is always a possibility that at that moment of time, our relatives will consent to this harvesting. And
after seeing all these campaigns, I still have a doubt about the outcome of this campaign. I think to make photographs and to make group photos, people are making the pledges, posting the holding with the posters that they pledged. And I really do not know how far this is in real sense. It will do it will do a good contribution in long run. So, do you have any suggestions for constant follow-up of all these pledges already made?
Actually, there is a it is a what you call still evolving field, because one of the objectives that the government has given KNOS as a second objective is to maintain a registry of patients who have undergone transplant, that is a recipient directory. They have also asked KNOS to have a registry of donors. So the still to retain public confidence in continuing this what they call permitting this organ donation and harvesting, we have to make sure that a lot of undeserved criticism of the program, that is what has happened during many in many social media, as well as that is a very irresponsible comment by certain people who are regarded high by us. You know what I mean. There have been comments about some modern medical treatment things also by persons who are holded high in social esteem. That they should actually refrain from. And they should understand that for a patient who is registered into a deceased donor program, it forms their only hope to life. That is why I said sharing love, sharing life. So if the society has to see that these people get organs, and we know that even there are instances where where there has been when there is a call that a patient needs an organ, even unrelated patients have been stepping forward in a young child, maybe about 3-4 years old. When there was an appeal that somebody donates, we know that an entirely unrelated housewife came to donate a part of her liver for that. So there is a lot of goodwill in the family, and it is up to us as a society to see that this interest or this good intention reach their logical culmination, and they should be allowed to donate, and that is what I think has been done. So as professional bodies, we can take this forward. We can mingle with our a lot of people or social leaders to create that a good environment is built up for for ensuring that these sort of activities are carried forward, and a lot of people get that vital organ in time to save life.
Anyway, that was a wonderful discussion. Dr. Devi ma'am, would you like to add anything from the Foxy side?
Foxy side, we had really more than 1,000 people who have registered for organ donation today. But like how you said, see, Foxy has promised for the e-card, donor card. They said all these people who have registered to that link will be given a Foxy card. So, but then again, that doesn't mean that all of these people are going to donate their organs, because it's still, I feel, after our death, it is the family members' decision. Unless they are also willing to give, I think we cannot do that. And sir, Vasudevan sir, that's what I gathered from today's, the entire day we have been spending on this organ donation only.
Yes. Yeah. The submission forms does not entail that an organ can be harvested. It has to be a final consent has to be given by the family, because the person who has submitted, of course, it helps that his mind has already been revealed. But immediately, and when we have that donor card, which we display in big letters in our home, it makes our immediate relatives aware that that is our wish, and we can only hope that that wish will be carried out at that crucial moment.
Yes, sir.
That's the situation now in India. As we said, there is a opt-out policy in many countries where actually the organ donation is the norm of the day.
Compulsory.
So that is why Spain is the world leader in this thing. Actually, Spain was not doing well, but it happened that all the patients who needed, that is the potential recipient, they formed a sort of a group, a pressure group, and they sort of influenced public opinion and the government to change the rules so that this could be happen. So that is how Spain became a country of opt-out policy. So it has happened in several other European countries also, and because of that, the supply-demand gap in that countries is very very much reduced, and the national government is trying a lot to get that expertise from the Spanish government. So there has been a lot of exchanges between both these government things, and the Spanish officials have visited Kerala also. So much so that they have been guiding the training programs, etc., and slowly bringing about a change. But ultimately, it is the attitude of the people and their wish to contribute to this cause that is most important.
But
Also,
anyway, the seed has to be sown. That's
Yes,
all.
yes, as to be so.
and also I request Ramani Madam, please send that 2 videos so that we can incorporate the original videos into the recording, because
Okay.
through the Zoom it was coming little bit erratic.
Okay. Okay, I will send it. I will send it.
Can I also mention a point?
Please, sir.
Actually, last year we had a person who came to me. He's Rajesh Nair, who has directed many successful movies in Kerala. The last movie he did was Trishur Puram. It got released about 2-3 months back. Sometime back, Rajesh contacted me and he said he was settled for a long time in Uganda. He came back to Kerala and he's full-time now doing movie direction. He wanted to contribute in some way to this, and the way he did it was very interesting. He is also a visiting faculty at the K.R. Narayanan Institute of Visual Art, Visual Sciences and Art, which is in the suburbs of Kottayam, near Pala. So he, while discussing with his students, he asked them, what are the ideas you have for making a short movie? He was training them in taking small movies, short movies. And many of them spontaneously said, we want to do a short movie on organ donation. So he presented me 3 videos, which are all of 90 seconds each, showing us about several stories which highlight organ donation. So I will be happy to share with Dr. Kunjumoideen those videos. I think you can put that as part of the recording.
Yeah.
Yes.
It is only 90 seconds, and
Okay.
it gives a very good feel about the noble thing. And one of them shows about when the parents of a donor later meets a recipient who
Yeah.
has whose life has been saved, and they come to meet the son. And actually, initially, the movie shows that he is very reluctant to talk to them. Naturally, but slowly that ice breaks, and he understands that this person is living because of the contribution that his son did. So that is actually a very moving, and it's only 90 seconds. I will share these 3 videos with you so that it can be put into mass circulation.
Okay.
Yeah, please share, sir. You can send to my email ID so that we can
Yes.
include recording.
Yes.
So it will be useful for all the members who couldn't attend on time, being a working day, and many are simultaneously watching IMA activities as well, because so many parallel activities are going on, and we were very particular to keep this session on today itself, as because the Doctors' Day cannot be celebrated on another day, just like any other public health days. So we will sit together again on probably on 13th of August, and to see other than me and Wahab, who else are there who have signed, who will be ready to sign the pledge. And see, whoever will be signing from Birdal Society, I think on behalf of the society, I can assure you that will be the real ones, not for photography purpose. It will be the real pledges that we will come out with on 13th of August. And it was really wonderful session. In fact, see, even before sitting for this session, I did not have much idea, in spite of hearing too many things from here and there. Now it is very crystal clear. And that is the talent of the speakers. And now I request Dr. Wahab to express official vote of thanks. And before that, all the society members and all those who are looking into the live streaming, that we are going to have a wonderful conference, Noisis, that is real virtual reality conference on augmented reality, based on augmented reality and artificial intelligence platform. And we already have confirmed with 4 to 5 international faculty, and hope we'll be able to have very wonderful session. And again, we'll have the expertized lecture from Dr. Remini ma'am again on that day. And so with these few words, I hand over the mic to Dr. Wahab to say vote of thanks and conclude.
Thank you, Ramani ma'am, and also the wonderful speech by Vasudevan sir. And we are actually very lucky to have madam every now and then. Last time also we had Ramani madam with us for the Yoga Day program. So thank you very much, and thank you all the faculties who actually participated actively in this program. And as our Dr. Kunjumaydin, our president, told, this should be a real pledge, and we have to actually willingly and with our full will, we are all supposed to take a pledge for donating our organs for even after our birth, our death, somebody has to get a birth or a life for them, and that is very important. So with that, I think thank you for all for your patient hearing in the Zoom and in this Corona time. Thank you.
Yeah, thank you all. We'll sign off. Thank you, ma'am. Thank you, sir. Bye. See you.
Thank you. Thank you.